We'll switch over now. We'll show you the app. We've entered the patient's baseline data. We're going to show you the change in steroid toxicity between baseline and the V2 visit, the second visit, and then between the V2 visit and the V3 visit. We've already entered the baseline data. So let's enter the data for the first follow-up visit. Say, hypothetically, this is 13 weeks. This is the main screen, the home page, if you will, of the GTI app. And it is arranged according to a logical flow in a clinical trial visit for a patient. So the first thing that happens is the coordinator will update the patient's medications. The patient's baseline medications were already entered. The patient was on insulin. You can see over on the lower left at baseline. Now, at the first follow-up visit, the patient is off insulin. His glucose metabolism has improved. In addition, his lisinopril, 20 milligrams at baseline, is now 10. So he has had improvements in both of his medications to treat glucose metabolism and to treat blood pressure. And now we confirm that the intention was to decrease both of those. Then we go to vital signs. The vital signs from entry are shown on the left. The patient was 1.64 meters tall at entry and weighed 96 kilograms. The BMI calculated automatically. Now at follow-up, his height has not changed, but his weight has improved substantially. He's now down to 89.1 kilograms. His blood pressure has also improved, going from 144 at baseline to 132 over 85. There's been a significant improvement. The hemoglobin A1C is now down to 5.5%, despite the fact that the patient has been able to stop his insulin. His LDL hasn't changed very much. It's 3.1 now in follow-up. So the LDL is now complete. Bone mineral density is a very sensitive indicator of prednisone. So the bone mineral density is 5.1 at the femoral neck and 5.0 at the lumbosacral spine. Now the clinical research coordinator might put the patient into a room. The research coordinator has finished with what he or she needs to do with the patient, checking medicines, vital signs, weighing the patient, etc. Patient goes into an examining room where the clinical investigator examines the patient for myopathy, for skin changes, for neuropsychiatric toxicity, and for infections. So the patient did have myopathy at baseline, but now it has resolved. So up in the upper left, you see that he had a minor steroid myopathy at baseline. The app cues the investigator into what these definitions are. All of the use materials are contained within the app. Now we move to skin effects. So the patient had lots of skin effects at baseline. In the upper left, you see that there was moderate hirsutism, there was a minor acneiform rash, and there were striae that were moderate. There are skin effects now at follow-up. The hirsutism has improved. It is now only minor. And the definitions, again, of each of these grades is included in the app to facilitate rigor. You can blow up some of these images. Acne has actually resolved. The striae remain moderate. Then we move to the neuropsychiatric domain, and the patient had these manifestations of steroid toxicity at baseline in the neuropsychiatric domain. There was moderate insomnia and moderate depression. Both of these are now minor at follow-up. Again, the definitions of these neuropsychiatric toxicities are included. And then we go to infections. The patient had oral candidiasis at baseline, one episode of oral candidiasis, again, between baseline and week 13. So that completes the changeable elements of the GTI. And now we round out the list of other toxicities by looking at the specific list. And we'll just say that there have been no additional toxicities, but it shows that the patient had a cataract at baseline, and that was carried forward now to this follow-up visit because items in the specific list represent damage, they don't change. Okay, so now we're complete and we can get the first GTI score. Over on the left-hand side, you see the individual domain scores. And then in the upper right, you see the cumulative worsening score and the aggregated improvement score. And what this demonstrates is that there has been a little bit of worsening. The patient did have an episode of oral candidiasis between baseline and week 13, but all in all, there was substantial improvement in steroid toxicity. AIS had actually improved by minus 209 points. We're on visit 3 now. This is maybe week 26 or 6 months after the baseline visit. There has been no change in the patient's medications. So the insulin remains off. The lisinopril is still 10 milligrams a day. And we confirm the clinician's intent, which is not to change the medications. We look at vital signs, and both the data from trial entry and at the previous visit are shown here. Now we'll say that the weight is 90.2 kilograms. The blood pressure, however, has continued to go down. It's now 132/84. The labs now at follow-up, the hemoglobin A1C is 5.4%, and the LDL is up a little bit to 3.3. The bone mineral density has not significantly changed here, 5.2 and 5.2. The patient's muscle strength is normal. And with regard to skin effects, hirsutism, which was minor at the last visit, has resolved. The atrophy stria remain minor. Neuropsychiatric effects, the insomnia is now gone, but there remains an element of minor depression. There have also been no infections between week 13 and week 26. And now we just scroll down the other toxicity to complete and make sure that there has not been other elements of steroid toxicity that would be recorded in the specific list. They're not. And we can go now to the GTI score. And this sums the entire score since baseline. So the cumulative worsening score, because of that infection, because of that oral candidiasis that occurred in the first GTI interval between baseline and 13 weeks, that is reflected in the 19 points. But the patient has continued to have improvement in overall steroid toxicity, and the aggregate improvement score is now minus 257, a very nice improvement overall in steroid toxicity.